Hi there, this is Sarah Price, and this is my video for Professional Nursing, Nurse 4080. This is video 3, Professional Reflections. In this assignment, we are reflecting on trends in nursing that we think will have the greatest impact on our future practice, and then explain how we project that impact in context of professional nursing values, ethical legal standards, and role as a member of an interdisciplinary team. So there are two trends that I looked at. One we'll go into briefly and another in depth. The first trend is community-based care and how that is increasing. One interesting aspect of this is nurses in the workplaces. Personally, I have a good friend who works for a large bank on the East Coast, and the offices of this large bank provide RN and advanced practice RN run clinic strictly for the employees and their families, in the sense of that's a community of employees. Nurses in workplaces can also work to prevent musculoskeletal problems in the office, as well as fall prevention. So community-based care is also increasing because of the emphasis in the Affordable Care Act on comprehensive community participation in the community members' health. There also can be nurses present in community centers like the Y. And patients often find these settings more convenient and more comfortable than a traditional large hospital or a doctor's office. Another increasing method of this community-based care is clinics and drugstores, like Minute Clinic and things like that. And they're often staffed by advanced practice RNs. So the second trend that I looked at in depth is nursing data and informatics. So a large amount of data is being put into EMRs across the country, EMRs and electronic medical records across the country. And in addition to that, there's so much self-reported data that is becoming a huge trend, and that is from things like Fitbit or Apple Watch. There's home spirometry systems for patients with COPD or with asthma. There's also an app and device, Cardia Mobile, that works with Apple to make sort of a home EKG projection. So big data that is gathered from all of this is important for finding patients for clinical trials, as well as modeling. The big data can also include some other personalized data like genetics from 23andMe or allele data that patients can contribute after their own effort using these systems. So that modeling can help determine how patients will react to certain medications, which is something that a nurse would educate them about, or which treatments would work best. So this would be a nurse working as a member of a team to help the clinician or provider decide which treatments will work best based on data informatics. Why will this trend have such a great impact on nurses? Well, data is great, numbers are great, but it still needs a knowledgeable human to understand it, to use it, to know what it means, and to apply it meaningfully. So, for example, some EMR systems can pool or analyze data to alert clinicians of trends or red flags, but that data needs to be measured and entered properly, usually by nurses at the bedside. And the outputs from the EMR need to be reconciled by actually looking at the patient and assessing the patient. Does this make sense based in the context of my patient? So I think that nursing informatics and big data is going to be a huge trend, and I want to assess that going forward in terms of professional nursing values. The first value that I just sort of got into is critical thinking. So looking at that data and using critical thinking in the context of your patient. Does this trend make sense? How would a patient's meds or conditions affect certain values or trends? A second nursing value is autonomy. So nurses value autonomy by respecting patients' rights to make their own decisions about their health and their care. So, for example, a nurse may say that numbers and trends say a patient may have this disease or fall into such and such risk category or may develop a certain disease. So the nurses can take that informatics, the numbers, the trends, and tell the patient, educate them, but they honor the patient's decision from there and all their decision making from there. So you inform them, but then allow them to autonomously consider what you've educated them about. The last professional nursing value that is important in looking at this trend is integrity. So as big data grows, nurses are responsible for fiercely protecting their patients' privacy. Nurses are, of course, required to abide by a code of ethics, but should also hold this requirement naturally as part of their personal nursing values or personal nursing philosophy, which is important to me, of course, as my personal nursing philosophy. And lastly, confidentiality as a value knows and understands the value of data, but because of integrity, it respects that it is owned by the patient and not the system. So that data is owned by the patient, and system informatics is not entitled to that data. Okay. Ethical and legal standards also apply to this trend. So the American Nurses Association Code of Ethics for Nurses includes the provision that nurses advocate for and protect the rights of the patient. This includes confidentiality of their data and information. And one legal standard we should consider is the written record of nursing assessments and interventions. So not only is it important to accurately document these assessments and interventions to assure we are contributing to quality, clean, structured, and standardized records, but need to remember that the medical record becomes a medical legal record that can be used in court or a liability case. Lastly, data informatics going forward will have an effect on the nurse's role as a member of an interdisciplinary team. So all data entered or presented by nurses is integral to the healthcare team's understanding of an individual patient. But in terms of informatics, the data entered on the front end at the bedside goes on to be the big picture when it contributes to the aggregate data that's analyzed by scientists or specialty experts. So because nurses are on the front line of gathering this data, they should also play a role in the team of designing those systems and how they can be a part of the team that designs the systems where that data is entered. They also can be part of a team that develops how this data is communicated within other teams who are providing care for this patient. So this is my video for professional nursing and reflecting on professional trends in nursing. Thank you.